You always say that workforce well-being is different entity in healthcare.
Okay, deep breath. Not going to get on the soapbox, but also probably will have one foot, because as these companies, they're acting like vendors, and healthcare organizations are contracting with them to bring like wellness to their employees. And it gets me really riled up because they don't understand a core distinction that healthcare workers endure. And I mentioned it before, is a phenomenon of moral injury. So as a physician, I was trained to provide a certain standard of care to my patients. And when I cannot provide that care, every time I cannot do that, it injures me. It injures me morally, deeply. It burdens me. It cognitively depletes me. This phenomena that I cannot explain in words, because you have to be there when your hands are tied and you cannot practice to your full scope because of all the red tape. It is a nervous system, deep, visceral depletion. And the reason I say this over and over again is, if you have not experienced this, if you have not witnessed somebody experience this, how can you go into a healthcare space and talk to these healthcare workers and make them feel like the burnout, it's their problem, when you don't understand what moral injury is? In healthcare, you cannot talk about burnout without acknowledging the suffering that is coming from moral injury. And moral injury is coming from the outside. It's not something that I am imagining. Burnout in healthcare is a phenomena that we borrowed from other industries. So yes, I don't think that somebody who has never experienced moral injury should be out there running a company, helping people with moral injury. So if you are a company who's trying to help, I'm not saying that the intentions are bad, but the strategy is extremely lacking. Do not go there and tell these people, these poor, overworked people, that they are imagining their suffering and that they can mindset their way and yoga their way out through moral injury, because they can't.